With suspected COVID-19 patients. Restrict residents with fever or acute respiratory symptoms to their room. If they must leave, have them wear a face mask. Stay home when you are sick. This includes when you are experiencing any recent fever or current symptoms of a cough, shortness of breath, or a sore throat. Reduce the number of non-essential staff who come into contact with the patient resident. Non-essential staff are considered those staff who come into contact with patients' residents or patient-resident rooms, but do not provide direct care, such as administrative staff, housekeeping staff, maintenance staff, meal delivery, and activity staff. To reduce the interaction between non-essential staff and COVID-19 patients, shift duties from these staff will be decreased and transferred to essential staff. Only essential staff should go into the room of a confirmed or presumed COVID-19 patient. Reduce the movement of staff between patients with and without COVID-19. Cohort staff and patients in one area of the building if possible, and keep the equipment for these patients' residents in this area to limit the spread of infection. Avoid working in other areas of the facility, e.g., going between assisted living and extended care facilities. Caring for individuals suspected of confirmed COVID-19. Disclaimer: healthcare personnel caring for an individual with COVID-19 should contact their local and/or state public health department for guidance on the current practices and management, in addition to following CDC updates for changes of general guidelines. Suspected or laboratory confirmed COVID-19 infected patient. As there have been shortages of supplies of N95 respirators, the following recommendations are consistent with the World Health Organization and CDC recommendations for resource-limited settings, which could include all healthcare facilities throughout the U.S., but in particular include skilled nursing facilities, SNFs, and other elder care facilities. Droplet precautions. During all lower-risk care or non-respiratory treatments, for suspected or confirmed COVID-19 patients, utilize droplet precautions. This includes the utilization of surgical masks or procedure masks, eye protection, gowns, and gloves. If N95 masks are in limited supply, staff are recommended to prioritize their use to only respiratory procedures likely to result in aerosolization of the viral particle. These procedures include nebulization, suctioning, tracheostomy care, and application or adjustment of oxygen masks. Other respiratory illnesses. Individuals not suspected of COVID-19 infection, but of another respiratory infection such as influenza that is not classified as an airborne transmission. You should also utilize surgical masks or procedure masks, eye protection, gowns, and gloves. Finally, most skilled nursing facilities and ALFs do not have airborne isolation rooms. If there is a suspected COVID-19 infection, it's recommended to isolate this individual in a single room with a closed door, pending consultation with your local health department. Access to this room should be limited to only essential personnel to reduce the risk of spreading the infection.